Stem cell therapy, a new hope for multiple sclerosis patients. MS or multiple sclerosis is an autoimmune disease that attacks the protective sheath surrounding the nerves in the brain and spinal cord, resulting in inflammation, pain, and a host of other problems, including paralysis and blindness. What exactly causes multiple sclerosis isn't known, but it's thought to involve a combination of genetics and environmental factors such as viruses or bacteria. So far, there's no cure. However, that may be changing soon with advances in stem cell therapy specifically designed to treat MS patients. Facts about multiple sclerosis. MS is a debilitating neurological condition affecting nearly 2.5 million people worldwide. 1 in every 400 Americans is living with this disorder, and it may cause damage to the nervous system and disrupts communication between the brain and other parts of the body. What causes MS is still largely a mystery. However, scientists have identified specific characteristics of people who suffer from MS, including their age of onset and gender. For example, 80% of people with multiple sclerosis are women, and symptoms usually develop between the ages of 20 and 40. Symptoms tend to be worse in cold climates as well. The most common symptom is chronic pain, but the list can include blindness, loss of balance, depression, bladder problems, and many more. The first signs of multiple sclerosis include numbness or tingling sensations in one limb or on one side of the face. These warning signs could progress over time into complete paralysis if left untreated. Stem cell therapy experts like Dr. David Greene Arizona suggest that stem cell therapy could prove beneficial for patients suffering from multiple sclerosis due to the ability to reduce inflammation and modulate the immune system, which may alleviate some of these symptoms. About mesenchymal stem cells. These multipotent adult stem cells can differentiate into many different tissue types and play an essential role in our immune system. Researchers have found that these cells can reduce inflammation, modulate the immune system, and protect neurons against degradation, and still, the research is going on. If this becomes a reality, it could be highly beneficial and a blessing for patients suffering from mesenchymal sclerosis. How do MSCs work? These stem cells have been found to have anti-inflammatory properties and successfully reduce chronic inflammation in animal models of colitis and arthritis. In addition, researchers believe that MSCs can modulate immune responses, making them an excellent choice for those with inflammatory disorders like multiple sclerosis. Orthopedic issues with multiple sclerosis. Although more research is still needed, stem cell therapy may prove beneficial in treating conditions like multiple sclerosis. With MS, the body's immune system attacks myelin sheaths that protect nerve fibers of the brain and spinal cord. As a result, it may cause inflammation, leading to symptoms like tingling sensations, balance issues, and leg pain. Dr. David Greene, an orthopedic surgeon, suggests that stem cells may provide the hope of repairing damage to joints or cartilage in people with degenerative arthritis. Mesenchymal stem cells can reduce inflammation as well as modulate the immune system, so it doesn't cause as much damage, both of which are a plus for MS patients. Is it time to try MSC treatment? Multiple sclerosis has no known cure or treatment that is universally effective. This long-term disease is caused by damage to nerves in the brain, which makes the transfer of messages difficult between the brain and other parts of the body. While there are still questions about MSCs and their efficacy, clinical trials with these cells have produced positive results so far. Since this treatment is relatively new, researchers will continue testing it to assess its benefits as a potential MS treatment fully. Wrap up. Multiple sclerosis is a chronic, often progressive, autoimmune disorder that causes nerve cells to malfunction and eventually die. This malfunction results from a broad array of symptoms like muscle weakness, blurred vision, numbness, and tingling in the extremities, fatigue, and more. Conventional treatments offer no cure but focus on managing these symptoms with medication. Dr. David Greene Arizona has spent his career researching stem cell therapies. Dr. Greene explains that stem cells have enormous potential. Considering this treatment under expert supervision might help introduce a medical breakthrough to repair any cell or tissue in the body. However, many challenges remain before stem cells can be used in medicine. Researchers are still working on reliably producing enough cells for transplantation and using them effectively to treat diseases.